Hi everyone, this is Dr. Jin Lee with Cure NGD, and today I'm interviewing Dr. Andrew Levy at Israel, who have developed a phenomenal gene therapy for IQ-Sec2. Thank you for talking with me.
You're welcome.
Do you mind talking us through what you've
Sure.
done and what's next?
So what we're IQ-Sec2, as many of you know, is a neurodevelopmental disorder associated with seizures that are resistant to drug therapy, severe intellectual disability, and autism spectrum disorder. We developed mice models of this disorder, a variety of different mice models, and what's presented in this poster are two knockout models of the IQ-Sec gene, in which the mice do not make any IQ-Sec protein or RNA. What we were set out to do was to see if we could rescue these mice from having seizures or seizure-like disorder, their impaired growth, and their abnormal behaviors. We generated, and the approach that we're using is essentially replacement therapy in these particular mice, using a adeno-associated virus with capsid 9, which is trophic for neurons. And in this case, we're using two different types of virus. One is using the rat gene, another is using the human IQ-Sec gene. We're using different types of promoters for the IQ-Sec gene that allow specificity to be expression of the IQ-Sec gene to be only in neurons in the case of one of the specific promoters. So what we looked at, I'll start from here, is the growth of the mice. This is all the different groups, whether they receive the human virus or the rat virus, mice with a knockout of the IQ-Sec gene, or the control mice, and looking at their growth over the neonatal period out to about 4 weeks of age. What we were able to demonstrate is that, with in particular our focus on the human gene, these are knockout mice are shown here. These are mice that do not produce any IQ-Sec gene, and this is their growth over time. When we provide the mice, these knockout mice, with the IQ-Sec gene, their growth is very similar or nearly similar to the wild-type mice that did not receive any virus at all. In other words, this is able to rescue, in large part, the impaired growth and development of these mice over time. The second parameter that we looked at is a model of susceptibility to seizures using ECT. This is a test that involves applying an electric shock to the mice and looking for their threshold to develop seizures. These mice are known to develop seizures. They develop seizures. This is a very quantifiable way to look at the threshold for seizures in these mice. What's known is that mice without IQ-Sec2 have a increased threshold in order to develop seizures. And this is been previously demonstrated by the SANS lab, due to the effect on interneurons that are inhibitory. So you're inhibiting an inhibitory pathway, thereby increasing excitation overall in the brain and producing seizures. What's demonstrated here is recapitulating that finding, that the threshold is much greater in the mutant mice as opposed to the wild-type mice. And this treatment with the virus is able to restore the threshold to essentially normal levels, to make the seizure threshold similar to what occurs in normal wild-type mice. The next study I'll be talking about, next parameter we looked at in regard to efficacy, is looking at behavior. In this case, we're looking at two different well-described paradigms. This is done in collaboration with a group from Japan, Shinshu University, receiving either the human or the rat virus, and in looking at the ability of a mouse to choose either associating itself with another mouse. Mice are very social animals, so normally they would prefer to associate with another mouse as opposed to an empty cage. So mice normally that have a knockout, or they're not making any IQ-Sec2, they don't distinguish between an empty cage and another mouse. However, when you restore the IQ-Sec gene, the mice now prefer the mouse as opposed to an empty cage. So that's showing that they prefer, they have a social preference for other mice as opposed to no preference at all, is rescued by this particular treatment. This particular panel is looking at another parameter, and that looking at novelty. Mice also seek out novelty, similar to people. That they seek, if you were to expose a mouse to a mouse that he's previously been exposed to, or to a new mouse, he will prefer to go to something new. This is referred to as social novelty. The mice prefer to see novel experiences. So again, here a normal mouse will be preferred to go to a novel mouse as opposed to what was referred to as a familiar mouse. Whereas with the knockout mutation, there's no preference. Giving back the IQ-sec gene, we were able to restore this preference for the novelty, for the novel mouse. So taken together in these three different paradigms, we're able to show that the human AAV is able to rescue abnormalities in the knockout mice. Overall, we believe that this ability to show benefit in this model may warrant moving towards clinical studies in boys with a similar type of genetic profile, in other words, knockout for the IQ-sec gene, which represents about 80% of all boys with IQ-sec mutations. We're encouraged by the fact that some of these treatments, in particular the behavioral treatments, we're able to demonstrate benefit even when the mice were essentially adult. So we're able to restore the normal phenotype even when the mice were at an advanced age, which is always a major question in these neurodevelopmental disorders as to whether, what is the developmental window in which it's still possible to rescue the mice. And this would suggest that that window can be extended over a longer period of time, maybe even into adulthood.